Hi everyone, Dr. Smith here again with Atlanta Upper Cervical Chiropractic. And as we're moving into this fall season, I wanted to take a little bit of time to talk about some of the activities that are coming around, some of the sports that are coming into season, what are the injuries that can be sustained during these activities, and what are some things that we can do to help, right? So fall is absolutely one of my favorite seasons, and a big part of that is football. Football is a huge part of the culture of the South. It is a very active sport. It can be a high contact sport, of course. And so we want to make sure that we are keeping in mind certain things like concussions, whiplash injuries, any sort of injuries that can be sustained to the spine, whether it's the low back, mid back, or the neck. One thing that I feel like is overlooked oftentimes in the concussion protocol is something called post-concussive syndrome. This is after you've been cleared from that initial concussion protocol, but players are still dealing with things like neck pain, headaches, maybe dizziness, maybe ringing in the ears. These are all things that we've seen patients for in the past. Usually there are some lingering misalignments that have happened to the upper neck that are contributing to these symptoms sort of lingering or persisting beyond that initial protocol clear. So want to make sure that we're being safe out there, making sure you're using good form when you're tackling, but also if you do sustain an injury, make sure that you get checked for any of those issues that we just mentioned. So next. So my favorite, the other football, is just probably swinging out of season with the MLS, but I know I played a lot of travel ball in the fall. Soccer is a less contact sport than football, certainly, but there are tons of different injuries that can be sustained. I, in fact, broke my nose going for a header, collided with another player, and probably sustained a small concussion then as well. So want to make sure that when we are going for headers, we're using the front of the forehead, making sure we really don't contact the rest of the cranium with the ball. We want to also make sure that if and when we do sustain any injuries, again, whether it's a slide tackle, an elbow to the face, anything like that can happen on the pitch. We are keeping those things in mind, as we just mentioned before, things like post-concussion protocol. A lot of ankle and knee injuries happen in soccer, so we want to make sure that those joints are well tended to, even outside of just traditional rehab for something like an ACL tear or an ankle sprain. We want to make sure that the joint alignment of the femur, the tibia, the ankle bones as well, are all maintained, because without that, you're going to have a longer journey of recovery and possibly never fully recover from some of these injuries. So things to keep in mind when it comes to soccer. So next we've got basketball, which is just around the corner. It starts a little bit later in fall, but is mostly a winter sport. Basketball involves a lot of up and down motion, right? Whether it comes to jumping, shooting, rebounding, blocking shots. There are a lot of up and down forces that we need to keep in mind. So whether it's ground forces impacting through the foot and ankle, into the knees, into the hips and low back, we want to make sure that all of those joints are properly aligned, so that we don't have anything like low back pain, knee pain that kind of lingers and keeps you from playing your best. The other thing about basketball is that anyone who's played can tell you that a hardwood floor is not the most comfortable place to land. So making sure that we are checking in with those players that are sustained hard falls, especially to the tailbone, right? Falling on your butt, causing that initial sort of shock to the low back, something that we definitely want to check, make sure those joints are aligned as well. So next. And last but certainly not least, I'm going to lump these together because I can hold both of them with one hand each. Golf and tennis. A lot of golfers in the summertime have to wake up super early to beat the heat here in the South. But now as the fall season rolls in, things cool off and you can play all day long without having to worry about things being way too hot and miserable out there on the course. So when it comes to our upper body sports, I do want to make sure that the nerves that branch out of the neck and out of the cervical spine, that travel into the shoulder, arm, wrist, and hand, are able to function without any interference or any compression. We posted a lot of really great articles on our website that you can check out about a condition known as thoracic outlet syndrome, where we talk about not only the nerves but the arteries in this area, and how certain things like the collarbone, the ribs, the muscles that come across the shoulder and chest can sometimes compress these structures, causing things like shoulder pain, that numbness and tingling, or that pins and needles sensation that travels down the arm and the upper extremity, which can be really, really detrimental to somebody's golf game or tennis, especially with that overhand motion of serving. We do want to make sure that those structures are well taken care of and protected. And it all starts in the neck, right? All of those nerves. So making sure we're getting checked, making sure that we are paying attention to any imbalances that may develop, as we tend to play with only one side of the body. I'm right-handed, right-hand dominant. So we want to make sure that we also take care of the left side of the body so that we don't develop massive postural asymmetries as well. So those are all things that we take a look at here in the office, and things to keep in mind when it comes to some of these upper body sports. So that's it as far as my just breakdown of all the different fall sports and this time of year. I love when my patients stay active. I love helping to keep them active because, of course, exercise is such a big part of a healthy habit system. So thanks for paying attention. Thanks for being with us today here at the Atlanta Upper Cervical team. From all of us.
Yay team, go Red Guys!
Hey! Thanks everyone, we'll see you next time.